Hello, my name is Sriya Chakravarty, and I'm a fourth-year psychology BS student working in Dr. Sarah Mednick's Sleep and Cognition Lab. My UROP project is titled Effects of Menstrual Cycle Phase on Working Memory via Sleep Regularity Changes. The menstrual cycle is a vital and regular part of every woman's life. It affects 50% of the population, and yet there isn't enough research to truly examine how it can impact sleep and cognition. As a woman myself, I have a vested interest and passion in understanding the hormonal effects of cognition. This kind of research can help women all over the world in many kinds of relevant environments, such as the workplace, academics, and day-to-day cognitive load. It's unfortunate to think that research on women's health and well-being is sometimes not considered or overlooked. My research examines the combined effect of menstrual cycle phase and sleep regularity on working memory performance in 60 young women aged 18 to 35. Working memory was assessed using an operation span task, which involved memorizing strings of letters while solving math problems, before and after one night of sleep in the lab. For this study, the menstrual cycle was categorized into four main phases: menstruation, pre-ovulation, mid-luteal, and late luteal. It's important to note here that hormonal levels, specifically estrogen and progesterone, are lowest during the menstruation phase and highest during the mid and late luteal phases. Prior research tends to agree that the mid-luteal phase is quite important for working memory in women, and performance improvement is also selectively benefited from sleep during this phase, and this may be because of that high hormone interaction. So I hypothesized that women in the mid and late luteal phases will have better working memory, they will also have better sleep regularity, and sleep regularity will mediate this relationship between menstrual phase and working memory performance, meaning that sleep regularity is an intermediate step in affecting working memory performance via phase. To examine sleep, I looked at the Sleep Regularity Index, which generates a score from 0 to 100, with higher scores meaning better consistent sleep-wake times across a period of, in this case, about 30 days for each participant. While sleep regularity did not mediate the relationship between menstrual phase and working memory, I did find a significant moderation effect. Specifically, during the mid-luteal phase, higher sleep regularity was associated with lower baseline working memory performance, but greater improvement after the one night of sleep in the lab compared to the menstruation phase. These findings suggest that sleep regularity may influence working memory differently depending on the hormonal context. In high hormone phases, sleep regularity might be linked to positive and negative impact on working memory and cognitive task performance. Some research does indicate that this phase is associated with memory deficits in women with premenstrual syndrome, for example. In the future, I'd like to analyze the remote participant data that I have access to see if maybe there's a difference in performance when one doesn't come into the lab for a night of sleep to do the task. This might be relevant to workplace and academic settings, which is more natural and it's a non-controlled environment. And I would also like to use objective measures of sleep, such as analyzing brain activity. Thank you.